My name's Jennifer Weldon and I'm currently the Pathways to Community Living Initiative Project Manager for South West Sydney Local Health District. And I graduated from the University of Tasmania in October 2014 after studying with the Australian Institute of Health Service Management. The tasks that I do are really varied, from work with patients to having to make recommendations and points of view at ministry level for policy development. So it's really varied, and the Masters really helped me understand all the different levels of the health service so that I can adapt my communication to meet whatever level of the health service I was speaking to. Being a scholar for the Masters, I think made the mental health executive more aware of me within the service. I was asked one day to introduce a Ministry of Health training session, which put me in a position to be able to have some conversations with really influential people from ministry around mental health, and gave them the opportunity to see that I was quite knowledgeable around the patient group, and also to be able to think in a more strategic way about what was needed for that client group. That in turn meant that I got offered more opportunities to do different pieces of work, and has eventually ended up with me being successful with the project manager position. I feel a lot more able to be confident in what I can do, and confident in not only that I'm a really good clinician, but I can work with people and lead people in a really positive way. So recently, as part of my research, I got a scholarship to go and present at the ISQA conference in the UK at Westminster, and got opportunity to share my research from my studies on an international plane. And that the university were really quite fundamental in helping me prepare the abstract and being confident enough to submit an abstract to such a prestigious conference. I'd highly recommend this course to anyone who's passionate about healthcare and wants to learn how to make difference on a grander scale than an individual patient that you're working with on a day-to-day. I remember when I first started the course, one of the execs asking me why I was doing this course. And I said, I want to drive policy and I want to make change for everyone with a mental health problem. And I didn't really believe that maybe I could do that, but now I probably do believe that I can influence policy and I can make a change. I always thought I would just like to be a senior OT, and now I think maybe I want to work at ministry, and maybe I want to make a huge difference to mental health services as a whole.